Welcome back to the Lost Book of Herbal Remedies. I'm Emma, and today we've got an episode that's critical for anyone concerned about respiratory health. We're diving deep into Respiratory Syncytial Virus, or RSV, which has become a significant public health issue, especially for infants, young children, and the elderly.
RSV is one of the leading causes of severe respiratory infections, and it's particularly dangerous for vulnerable populations. Luckily, there have been some groundbreaking developments recently, including new vaccines and treatments. Today, we're going to break down what RSV is, the latest in vaccine technology, and the role that herbal remedies can play in supporting overall respiratory health.
We'll also explore some fascinating research on antiviral compounds from natural sources, including polysaccharides from seaweed, and we'll highlight a powerful herbal formula from the Lost Book of Herbal Remedies that can offer additional immune support. So let's get started. RSV is a highly contagious virus that spreads through aerosolized droplets or direct contact. It mainly affects the respiratory system, leading to infections like bronchiolitis and pneumonia, especially in infants and the elderly. For these at-risk groups, RSV can result in severe illness, hospitalization, or even death.
RSV is responsible for a large number of hospitalizations every year, particularly during seasonal outbreaks. The virus attacks the epithelial cells in the respiratory tract, triggering inflammation and sometimes causing long-term damage. This is why it's such a priority to develop effective vaccines, especially for those most vulnerable.
And that's where the recent FDA approvals of RSV vaccines come into play. These vaccines, designed for infants, pregnant women, and older adults, are set to make a huge difference in reducing the overall burden of RSV.
Now let's talk about how effective these vaccines are. One recent study focused on adults over the age of 60, and the results were remarkable. The vaccines showed an 80% effectiveness in preventing RSV-related hospitalizations and an 81% effectiveness in reducing severe cases, including ICU admissions and deaths.
Even among those with weakened immune systems, the vaccine effectiveness was still notable at 73%. This is a huge leap forward, especially for older adults who are at greater risk of severe RSV complications.
And what's important is that the vaccines have shown consistent effectiveness across different demographic groups, meaning they work well for people of various ages and health conditions. This will greatly reduce the healthcare burden of RSV, not just in terms of hospitalizations, but also in managing long-term respiratory issues.
To fully appreciate the significance of these vaccines, it helps to understand how RSV works. RSV is a single-stranded RNA virus that comes in two major subtypes, A and B. These subtypes are what make RSV tricky for the immune system to fight off because they allow the virus to evade immune defenses.
Exactly. Once the virus enters the respiratory system, it triggers a series of immune responses. However, the immune system's attempt to fight off the virus can sometimes cause additional damage, leading to symptoms like airway inflammation and respiratory distress.
This is why vaccines are so important. They help train the immune system to recognize RSV before the infection becomes severe. By producing specific antibodies against the virus, vaccines help reduce the damage caused by the immune response.
There are currently 3 major RSV vaccines that have made it through clinical trials and gained FDA approval. Arexvy by GlaxoSmithKline, mRESVIA by Moderna, and Abrysvo by Pfizer. Arexvy is designed for older adults, while Abrysvo is focused on protecting infants by vaccinating pregnant women.
These vaccines use different technologies, including mRNA and subunit vaccines, to create a strong and long-lasting immune response. For example, the mRNA vaccines instruct the body's cells to produce harmless versions of the RSV spike protein, which trains the immune system to recognize the real virus.
Subunit vaccines like Arexvy work by introducing purified pieces of the virus that can't cause disease but are enough to stimulate the immune system. These strategies are helping to provide comprehensive protection against multiple strains of RSV.
Let's take a closer look at how these vaccines work. The mRNA vaccines introduce genetic instructions that tell your cells to produce a harmless version of the virus's spike protein. This teaches your immune system to recognize and attack RSV.
On the other hand, subunit vaccines contain pieces of the virus itself, which stimulate an immune response without causing an actual infection. These different mechanisms allow the vaccines to provide protection that lasts longer and targets multiple strains of the virus.
While the vaccines are incredibly promising, there are some challenges we still need to address. For instance, there's always the risk that RSV could evolve and become resistant to the current vaccines.
And there's also the issue of cost. Developing and distributing these vaccines is expensive, which could limit access in lower-income countries. That's why ongoing research and public health initiatives are so important, making sure these vaccines are accessible and effective on a global scale.
Beyond vaccination, there's passive immunization. This involves giving high-risk individuals like infants monoclonal antibodies that neutralize RSV directly. Palivizumab has been around for years, but newer antibodies like nirsevimab offer even broader protection and last longer.
These antibodies are a lifeline for infants who are too young to receive vaccines or for those with conditions like congenital heart disease. By providing immediate protection, monoclonal antibodies help reduce the severity of RSV infections in these vulnerable groups.
A recent study in Germany looked at how different immunization strategies could prevent RSV hospitalizations. It found that switching from short-acting antibodies to long-acting ones like nirsevimab could significantly reduce hospitalizations in infants.
The study also showed that maternal vaccination could reduce hospitalizations by about 5.6%, while vaccinating older adults could prevent an additional 4.5% of hospitalizations over 5 years. These numbers highlight the importance of a multifaceted approach to RSV prevention.
Here's something really interesting. Research into bovine RSV has given us valuable insights for human vaccines. A nanovaccine for bovine RSV, which encapsulated key proteins in nanoparticles, showed long-lasting immunity in mice.
This research opens up the possibility of using similar nanovaccine technologies for human RSV. The sustained immune responses observed in the study suggest that we could develop vaccines with even longer-lasting protection.
As new technologies like nanoparticles and monoclonal antibodies evolve, the future of RSV research is bright. Scientists are also looking into live attenuated and vector-based vaccines, which could offer even more effective and accessible options.
On top of that, we're learning more about the long-term effects of RSV, especially in children, where it's been linked to conditions like asthma. This kind of research is essential for developing targeted interventions to prevent long-term complications.
Switching gears, let's talk about natural remedies. Recent research has shown that polysaccharides extracted from Laminaria japonica, a type of brown seaweed, have antiviral properties against RSV. In cell studies, the extract boosted the production of interferon, which plays a crucial role in the body's antiviral response.
What's fascinating is that the extract showed low toxicity while effectively inhibiting RSV replication. This opens up new possibilities for natural antiviral therapies that could complement existing treatments.
The discovery of these antiviral properties could lead to new therapeutic options, especially for high-risk groups like infants and older adults. Natural compounds, like those found in seaweed, might offer an additional layer of protection.
More research is needed, of course, but the potential for integrating these natural compounds into treatment plans is exciting. They could enhance immune responses and provide protection alongside vaccines.
Now let's talk about an herbal formula from the Lost Book of Herbal Remedies that can help support the body's defenses against RSV. This formula combines herbs like elderberry, astragalus, and echinacea, which have been shown to enhance immune function and provide antiviral support.
Elderberry, in particular, is rich in flavonoids and helps increase cytokine production, which is critical for regulating the immune response to RSV. Astragalus is another powerful adaptogen that boosts the production of interferon, helping the body resist viral infections.
This formula also includes herbs that soothe the respiratory system, like licorice root and mullein. Licorice root reduces inflammation and irritation in the respiratory tract, while mullein acts as an expectorant, helping to clear mucus.
And let's not forget Laminaria japonica, which, as we mentioned earlier, has direct antiviral properties that can reduce RSV replication. This herb works alongside the other ingredients to provide a comprehensive approach to managing RSV infections.
It's important to note that anyone using herbal supplements should consult a healthcare provider, especially if they're pregnant, breastfeeding, or on medication. Herbs like licorice, for instance, need to be used carefully, particularly in people with high blood pressure.
And as always, following the recommended dosage is crucial to ensure safety and effectiveness. Be sure to purchase high-quality, tested products to avoid contamination or potency issues.
The fight against RSV is progressing rapidly, thanks to recent advances in vaccines, treatments, and even natural therapies. With new FDA-approved vaccines and promising research into herbal and antiviral remedies, there are more tools than ever to protect those most at risk.
Whether you're looking to protect yourself with a vaccine or interested in complementary therapies like herbal formulas, the key is staying informed and taking proactive steps to safeguard your health.
That's it for today's episode of The Lost Book of Herbal Remedies. Be sure to check out the full article at herbalbloom.org for more in-depth information. And as always, take care of your health, and we'll see you next time.
Thanks for joining us, everyone. Until next time.